because every condition it liberates very similar clinical presentation, but having some tests and field examination is very important. The first diagnosing area is to do physical examination based on the patient complaint. If the patient is complaining that he has got, for example, depending on his explanation, will trigger us to do some laboratory or imaging tests. So physical examination is the first thing. By examining which area is being presenting himself as painful or discomfort. For example, if he's saying my bladder is not okay, you need to do physical examination of the bladder, and you do it thoroughly in order to figure out if really the bladder is not okay or is okay, or is this pain is liberating from another side. If it is a breast, then they do physical examination of the breast so that you can figure out where the inflammation or where the tumor are being liberated. That's number one. Number two is blood test. Blood test is whereby we take blood sample and specific machine for it are put in place so that we can measure to find out the tumor markers. So those tumor markers will help us to figure that indeed this person might have cancer or not. So what we call CIA, there are a lot of tumor markers that we can use to diagnose cancer. If it is the cancer of the ovary, we classify the tumor markers as CEO. If it is cancer, so the different key markers that we use to figure out the cancer diseases, depending on the explanation of the patient. So another diagnosing factor is imaging test. Imaging test, we are talking about CT scan, that's computer tomography, magnetic resonance imaging, and the other imaging tests. So those imaging tests will specifically give us a very good go-ahead on where the cancer is affected. If it is the brain, we can figure it out that the CT scan is positive, and the MRI, it might liberate as well being positive, because these things, CT scan and MRI, most of the time we figure the brain cancer. Another part of it is by biopsy. Biopsy, we collect a small snips, and we analyze it in the laboratory by differentiating the way the markers of the cancer they are seeing, the abnormality of the cells, specifically the abnormality of the cells. So those cells is when they will give a direction on if the patient has got cancer or not. Those are the key areas that much we look into in as far as diagnosing cancer is concerned.
Now, does cancer have treatment?
Yeah, being in the group of conditions, cancer is incurable, but at a point it can be curable, depending being it as benign or metastasis. If you are saying benign, it is localized one. You can exercise it and remove the affected cells. If it is metastasized, that means it will go and attack other cells and it will invade other body parts. Those kind of cancers, other areas that we need to look into as far as treatment is concerned. So number one, treatment is through surgery. Surgery can be benign, whereby you exercise the affected area. Number two is chemotherapy. Chemotherapy is when we give the medication related to cancer. Like in Malawi, they give vincristine in line that if the patient has got cancer, that's chemotherapy. That the vincristine is one of example of drug. The radiotherapy is when the cancer is at advanced stage and the chemotherapy cannot work on it, then we apply the waves, the gamma rays. so that those gamma rays should kill those cancer cells. And those things works best in well-developed area. Although in Malawi we have got other radiotherapy departments like at Maiwatu, the advanced as well as at the newly opened hospital of Dr. Tom Pinganjira, the cancer center. They are doing their radiotherapy, is being done there. Immunotherapy is when we are now trying to remove, for example, if it has attacked the lymphatic system. So that lymphatic, the whole lymph nodes, they are being removed and replaced with the new lymph nodes. So that's what we call immunotherapy, whereby if it has attacked the immune system, that immune system is removed and replaced with another new immune system from the donor. Then targeted therapy, we just target, for example, if it is human papillomavirus, we just target the attacked area. Like, for example, in this case, we are talking about the cervical cancer. So we just attack the cervix of the uterus. And that most of the time we do what we call cryotherapy. Cryotherapy is done in Tanzania. It's being done in Tanzania, Botswana, and other developing countries. Though in Malawi we are supposed to start, but there are other hiccups that are still being looked into so that we can do cryotherapy. And on treatment again, it will go together with some stages of cancer whereby we have got stage 1 up to 5. Stage 1 is localized, as I said, it should be just is a benign one. While number 2 stage is regional. The regional, that means this disease is now in the advancing stage. It is able to metastasize. And stage 3 is when we have got advanced cancer now. You can no longer do anything about it. You can't remove it. While stage 4 is metastatic, it is now has started to spread all over other systems. So whatever treatment that you are giving, it will depend on this kind of stages. If it is at stage number 4, for example, metastatic stage, most of the time radiotherapy plays a very big role. And when it is at stage 2, like regional, and the chemical therapy can do. Localized one, surgery can play a big role. While advanced stage is both chemotherapy and radiotherapy can work together. Immunotherapy in Malawi are not yet to do it immunotherapy because we have got no technical expertise on this kind of method of treatment. So that's how we do treat cancer. So those are the areas about cancer, and that's the treatment of cancer cells.
All right, let's finish with the prevention measures. What are the preventive measures of cancer?
Cancer as a group of disease can be prevented. Number 1 prevention is healthy lifestyle habits. Lifestyle habits like avoid eating anyhow so that you should not develop obese, which will put you at risk of developing cancer of the skin or other cancer of other different types, can be tumor or other type of cancers. So lifestyle is very important in management of this, in prevention of cancer. Number 2 is regular screening. Make sure that you have time that we need to meet a medical professional for just screening. It's not usual that you need to go to hospital when you are just sick, no. But sometimes it is very advisable that you go to hospital set up just for regular screening, medical checkup. Another thing is vaccination, especially in now we are encouraging that every childbearing female should give an HPV vaccine so that they have to prevent what we call human papillomavirus, which is responsible for causing the cervical cancer. And again, we need to receive hepatitis B vaccine because hepatitis will attack the liver, This, when you attack with the liver, you can end up having cancer, because the chances for you to develop into cancer is very high. In addition to that, you need to avoid tobacco and alcohol, which is again another lifestyle movement, whereby alcohol and tobacco has got the chemical in the body and will liberate into nothing but the scarring of the cells, and that again has got a chance to develop into any type of cancer. Can be lung cancer, can be liver cancer, and can be even the skin cancer. So those are the areas that we need to put much emphasis on in terms of prevention. Balanced diet and nutrition is very important. You need to eat balanced diet so that your immunity is strong enough, so that this, in so doing, you will not be attacked by cancer cells. Because immunity, balanced diet on its own, it boosts immunity. So if immunity is strong enough, the chances for you to get infection is very rare. As such, you can have a very good chance of evading this kind of cancer. So nutrition, let's have a well balanced diet, and our nutrition should be of well standard, not too obese and not too little. That's what we can say about the cancer.
All right, let me thank you once again, Mr. Joseph, for giving us your time to come here and explain what cancer is. At least we've got something from your presentation, the definition of cancer and their types, what causes cancer, signs and symptoms, diagnosis, treatment, and stages of cancer. At least now we have something that tells us what the cancer is. Listeners, thanks for being there. Listen to our program. Till we meet again in the next episode, as we'll be coming with more medical conditions. You were with me, Deepness Nchoka, the producer and editor of this program, and our guest was Mr. Gift Josam. Till we meet again in the next episode. Bye.